Thank you, Madam Chairperson, Dato Dr. Hisham Shah bin Muhammad Ibrahim, Deputy Director General of Health, Research and Technical Support, Ministry of Health Malaysia, Dr. S. Azmaliza binti Ismail, Manager, National Institute of Health, Dr. Noor Haji Ahmad Shauki, Director of the Institute of Health System Research, as the Chairperson of the Organising Committee of this seminar, Professor Dato Dr. Haji Abdullah, CEO of the Malaysian Society for Quality in Health, as the co-chairperson of the Organising Committee, and ladies and gentlemen, all the distinguished participants who have taken time to join us this morning. Assalamualaikum warahmatullahi ta'ala wabarakatuh and salam sejahtera. It is my privilege and honour to welcome you to the launch of the Malaysian's National Policy for Quality in Healthcare. I would like to first congratulate the Institute of Health System Research for the excellent arrangements for this seminar. Together with its partners within and outside the Ministry of Health, IHSR as the national coordinating body for the quality assurance and quality improvement, and WHO Collaborating Centre for Health System and Quality Improvement took the lead to realize this mission with the guidance of the World Health Organization. Ladies and gentlemen, across the world and even nationally, suboptimal quality of care has given to the increasing burden of illness and the rising of healthcare costs. 60% of death in low and middle income countries from conditions requiring healthcare occur due to the poor quality care, whereas the remaining deaths result from non-utilization of the health system. Building up the foundations of quality health system needs to be at the forefront of thinking, planning, and policy making. The development, refinement, and execution of a national quality policy and strategy are a growing priority as countries strive to systematically improve health system performance. To guide countries wishing to develop their very own national quality policy and strategy, WHO published a practical handbook for developing national quality policy and strategy in healthcare. In response to both the global and national call, Malaysia's journey began with the launching of the Quality Assurance Program way back in 1985. This was followed by the publication of Ministry of Health Strategic Plan for Quality in Health in 1998, which has now necessitated its revision. This new national policy for quality in healthcare for Malaysia is formulated to guide both the public and the private health sectors to systematically improve the performance of our healthcare system. The development of NPQH is aligned with the Ministry of Health Strategic Plan as well as other quality-related policies and strategies which exist in various domains to ensure its implementation is relevant and coherent. This document represents the consensus effort of our various quality champions within the Ministry of Health as well as its value partners from the various components of the Malaysian healthcare system, including private or public. It highlights the importance of realigning policies, organizations, methods, capacities, and resources to harmonize existing quality efforts and institutionalize quality improvement in our healthcare system. The quality of health services has a direct impact on health outcomes for people and communities. Our noble objective is to foster collaboration across ministries, cultivate inter-organizational collaboration as well as partnership with the community to understand what truly matters most to them. Building quality health services requires a culture of transparency, engagement, and openness about results. The NPQH seeks to internalize quality culture throughout the health system through fostering partnerships, healthy team working environments, and sharing experiences which are integrated throughout every organization. With transparent and open communication across all levels, we intend to support healthcare providers and make them feel valued and appreciated. learning from the experience of living through a time of a global pandemic, we need to be aware that improving quality depends more on the reorganizing resources, changing the way we work, and strengthening partnerships. Healthcare organizations must complement sound organizational processes with technology to achieve their desired outcomes. Ladies and gentlemen, if you cannot measure quality, you cannot improve quality. In the past decade, there has been a concerted international effort to improve measurement and reporting, and a growing consensus about the key domains of quality in healthcare. The agreed local quality definition in NPQH serves as a compass to steer and realign healthcare. This document identifies 7 priority domains, which includes its collective innovative strategies and action plans to facilitate its operationalization. The 7 strategic priorities areas are: number 1, improving integrated people-centered services. Number 2, strengthening governance for quality. Number 3, strengthening internalization of quality culture among all healthcare staff. Number 4, enhancing communication and engagement of stakeholders for quality. Number 5, building effective capacity and capability for quality. Number 6, enhancing measurement and quality improvement initiative. Last but not least, number 7, strengthening monitoring and evaluation of quality programs or initiative. Although this policy delineates practical strategies, its successful implementation calls for strong leadership to bridge the gap, to bridge the silo across all responsible parties, both public and private sector, to unite in executing and monitoring the outlined plan through empirical performance assessment. Our goal is to drive quality improvement efforts from the ground up. Such as assimilated strategy would ensure that resources devoted to health are used effectively in supporting people to live healthier lives. We aspire that the NPQH will not merely be an addition to the reservoir of the national policies or a document on the shelf, but will be translated into a systematic and coherent action plan to ensure that the vision of quality of the Ministry of Health is achieved so that all Malaysians will have access to a high quality of healthcare services. On that note, it is great pleasure with Kalimah Bismillahirrahmanirrahim. I launch and officiate the National Policy for Quality in Healthcare, and I thank you.